A very warm welcome back to International SOS in our London centre. You'll notice from our background today we're not normally where we are in the assistance centre in London. This is because we've started to deploy some of our own business continuity planning relative to social spacing as well as some of the restricted areas within our office environment. Today I'm very pleased to be joined by Dr. Kate O'Reilly, one of our specialists in public health. And Kate's going to take us through certainly an update in what's happening with COVID-19, what we're seeing in terms of changes over the last week. We're going to have a look at some of the business continuity planning steps that you may wish to take in your organisation. And then Kate will take us through a little bit of the telehealth, teleconsultation area. How in the environment where we're seeing limited travel becoming a real requirement for organisations, how telehealth and teleconsultation may add some value to your workforce. And then finally, we'll look at a bit about the evacuation environment, what's happening with air ambulances, and how we're managing in an environment that's becoming more and more challenging in moving patients. So let me go firstly to Dr. Kate and an update on where we've been in the last week with COVID-19. Kate.
Thanks, Mike. Well, another busy week in the world of COVID-19. So globally, numbers of confirmed cases have now exceeded 100,000, and the WHO is reminding all countries that it's important at this time that communities be vigilant and take the spread of the virus seriously to try and slow it its spread. And implement the containment and control activities that have been recommended so far. We're now up to over 100 countries affected, some more than others, and obviously those that had a few cases last week have got more cases this week, and so the situation is evolving still quite rapidly. And Italy is one of those countries who's seen quite a large rise in the number of cases. They now have over 7,000 cases, with over 360 deaths. And Italy has actually taken quite strong measures. They've put in place quarantine in the Lombardy region, including Milan and 14 other provinces. And they've closed schools, universities, museums, gyms, and they've also restricted movement in and out of these areas. So in the hope that this will, contain and slow the outbreak. China, where we first heard of cases, has reported actually the lowest number of new cases since January, and this is thought to be due to the success of its containment measures. So the world picture is changing on a rapid rate, and with all these travel restrictions that are being put in place, business continuity planning is obviously really important, and organisations need to take it seriously and proactively know how to manage this and put it in place. So perhaps you could give us a bit of an idea about what organisations should be doing in terms of their business continuity planning.
Yeah, absolutely, Dr. Kate, thanks. This is really an important part of where companies are going today in terms of having a strategic plan agreed across the management structure that is effective and protects your workforce. Where do you start with business continuity planning? Well, from my point of view, the key is to start at a crisis management structure. Have a formal team in your organisation who understand the roles that they play, understand the responsibilities they have relative to making decisions for your employees or for your business. That will start with the CEO or general manager of the organisation, the individual responsible for taking the decisions that are going to lead your clients safely in the continuity of delivery that they have, as well as your business and the ability to protect your workforce. Key to supporting that CEO or the crisis management team leader is going to be HR. And how are you communicating to your workforce, your employees? How are you going to keep them safe? And how do you make sure that the communications and messaging to them is well understood, is simple, it is basic, and it's giving them an understanding of what's the bigger picture? Also within your crisis management team, you want somebody who's going to look after your sales community, the clients that you're dealing with, as well as the providers. How do you keep your supply chain going? So they are critical functions. In today's event, Kate, we really need to have an additional role, and that's a pandemic manager. And this is a unique role, often from HR, sometimes from medical, if you have medical representatives in your organization. And they are starting to ensure the business takes the right steps at the right time, relative to the level that you've deemed appropriate for your business, and then manages the application of those steps. And I'll talk about some of those steps now. You probably want to start in terms of today's environment, and as Dr. Kate has explained, in watching what's happening environmentally. What is happening globally? This trend has grown since the beginning of January to be very much an Asia wave. We're now seeing very much a European Middle East wave, and presumably we'll see an American wave start to happen as we move over the next few weeks. So look at your travel policy, look at the agenda that you have relative to restricting travel for your workforce to ensure it stays as much as possible within safe bounds. But understand when staff go to a country or come back from a country, there may be limitations to them in terms of self-isolation or even government-demanded isolation. Look at access within your office as a next level. How are you protecting the workforce in your office from contracting the virus by limiting access? And I spoke earlier on about the fact that we've now limited access to areas within our business. You may want to do the same. You may want to have screening at your reception desk to check travel history or temperature. Communication and education. I mentioned with the HR aspect in terms of the crisis management, it is one of the most important parts. It's just making sure that your workforce understand why are you doing these things. When you have a work from home policy or you have a restricted area within your business, why? To make sure staff understand that, to make it simple, just brings a level of comfort and confidence in your workforce to ensure that the decisions you take, they are appreciated, they're valued, and the staff feel that you're doing the right thing for them. In terms of employee support, PPE, we all know it's becoming more and more challenging today to find things like masks or the alcohol gels. We need to have policies for that. You need to understand how you're going to apply that in your organization and start a process of looking at where that might be sourced from. In terms of the business continuity area, when you get into having your crisis management plan in place, when you've thought through the protection of your workforce, you start to look at what is going to enable you as an organization to long-term continue to deliver services. Then you can start to look at progressive steps that allow you to limit the access, control staff. You may want to have your staff split into two teams with half a team working from home one day and in the office the next day. That way, if you get some contagion in your office, at least you know your whole workforce is not affected by that. In the same way, you might want to go to an extreme level of full work from home model. That is disruptive for businesses, we recognize that, but these are unusual times, and I think we need to have steps in place that are going to protect your workforce, your ability to deliver services. And largely today, with communications as they are, a lot of things we can do from home if we really think hard about it. So with the change in travel restrictions and the guidances we're getting both at a government level as well as from an international travel agenda point of view, one of the things that becomes much harder, and we're seeing a lot of resistance now in our communities, is people don't want to go and see a doctor because we know that the sick patients are going to see doctors. So how do you start to build some protection around that in terms of approaching it from a company point of view in supporting your workforce, and what tools are available to you? Dr. Kate, maybe I can come back to you. Maybe you can just take us through a little bit of the precautions or measures we can take from a telehealth and a teleconsultation point of view.
Yeah, sure, Mike. Thank you. I think that's a really good point. And I want to remember that, within the outbreak, people still get sick and not necessarily COVID-19 related. People are also getting subject to, self-quarantine or imposed quarantine either at home or abroad. And this can actually, cause many issues. Some people will run out of prescription medications. Some people will need to see a doctor or want to seek a specialist. And simple things like, filling your scripts when you're in self-quarantine becomes much more difficult. So they need to obviously get that advice and help. And we have teleassistance, and this allows the individual to call up to any one of our 26 assistance centres. They can call in and have their medical issues addressed. So if they need to speak to a doctor, they can speak to them via video, have the consultation, and a treatment plan can be made with them and the doctor, so that they can be supported during this time, especially if they're in self-isolation. And equally, if they need medication or they've run out of their medication, we can source that for them and get it to them, so that they don't miss days of any essential medication. It allows them to stay connected and seek medical care as needed. We also, because people are in self-quarantine, it's a really good way of people feeling looked after and having something available to them. On the other hand, we've also seen cases where individuals need a medical evacuation from a country. And again, they're not sick due to COVID-19, but they need evacuating and bringing home. And where this happens, perhaps you could talk to us a little bit about building evacuation plans and that side of the planning of things for organisations.
Yeah, sure. I think critical here is really that companies need to have an approach, or they need to have a plan available that says what will they do if they need to evacuate people. We clearly see today with the government restrictions that just normal evacuations, irrespective of whether it has anything to do with COVID-19, is considerably more challenging. Moving somebody with a broken leg or some other medical condition is now not as simple as it used to be in terms of moving a patient. Now governments want to know exactly what the travel history has been. They also are very resistant to bringing in any patient from a country that has cases. And we've seen a number of nations shut down the borders to anything other than their own nationals. So there is a real care needs to be taken with where your workforce are, what kind of situation they are in. International SOS has a long capability in terms of dealing with cross-border pandemic type of events, such as during SARS, during MERS, during avian flu. We developed a PMIU, which is a personal medical isolation unit, which we have a number distributed around the organisation. This is the core of us being able to move COVID-19 patients. All of our assistance centres around the world, and we've got 26 around the world, who are focused on what are the implications, complications and restrictions and limitations in their own countries. How are they going to move patients? Where can they and where can't they move patients from and to? So that is part of our central thought policy. We've been involved probably over the last 4 weeks in moving patients who are at risk. Both from Wuhan, supporting evacuations from Wuhan back to Europe. We've supported evacuations from Japan relative to Diamond Princess. We've moved a number of patients across Europe who are COVID-19 positive. And so within our medical teams, we've got specialist equipment. We access a very carefully managed and accredited network of providers who are able to access equipment that we might not normally have on a day-to-day business. And especially moving COVID-19 patients, there is an extremely limited number of airframe providers, not only prepared to do this, but with the right equipment to do it. International SOS has a strong cadre of staff. We're able to move globally with the right protective equipment to support those kind of evacuation missions should they happen, and should we then need to support clients with movements. So we've got a good experience in this area, Dr. Kate. We're moving patients all the time now who are not COVID-19 patients within these difficult environments, but do understand it is more complex, it takes more time, the authority approval process is considerably lengthier. So with that, we will be discussing with you, should you have a need, to provide that support, and our medical teams will work directly in helping understand what may need to be undertaken in that case. Dr. King.
Well, it just leaves me to say thank you very much for joining us today. As the situation continues to evolve, please don't hesitate to get in touch for up-to-date advice and assistance regarding the COVID-19 outbreak. Thank you.
Thanks very much.